We are diving deep into the skull base with computed tomography, the Pterygopalatine Fossa and Foramen Rotundum. This small but critical junction begins with the Foramen Rotundum, through which the maxillary nerve passes. The Pterygopalatine Fossa serves as a central hub, where several anatomical gateways, such as the Infraorbital Canal, Sphenopalatine Foramen, and Inferior Orbital Fissure, intersect. To track the spread of pathologies, especially tumors, we must know this anatomical space, like the back of our hands. In the coronal plane, first the Pterygoid, Vidian, Canal, blue, then the Foramen Rotundum, pink, which is the main passage of the maxillary nerve, the second branch of the trigeminal nerve, are observed. These pathways converge in the Pterygopalatine Fossa, green, which is the central focus of the region. In the continuation of the sections, the Palatine Canal, purple, extending inferiorly toward the palate, the Inferior Orbital Fissure, yellow, marking the boundary of transition to the orbit, and finally, the Sphenopalatine Foramen, orange, opening medially to the nasal cavity are clearly distinguished. Pterygoid, Vidian, Canal. This is the back door of the Pterygopalatine Fossa. It plays a key role in the spread of vascular tumors such as juvenile nasopharyngeal angiofibroma. Additionally, the presence of the Vidian artery is a serious bleeding risk during surgery. The radiologist must report the depth of this canal to the surgeon. Foramen Rotundum. It is not just a hole. It is the main perineural pathway through which tumors of the nasolabial region or palate, e.g., adenoid cystic carcinoma, spread retrogradely into the cranium and cavernous sinus. Pterygopalatine Fossa functions as the most strategic, main distribution terminal of the skull base. Once a pathology reaches the Pterygopalatine Fossa, it gains access to the orbit, nasal cavity, and middle cranial fossa simultaneously. Therefore, the loss of normal fat planes within the fossa is the most critical early radiological finding of tumoral infiltration. Palatine Canal. It is the hidden staircase used by palate cancers while climbing up to the Pterygopalatine Fossa. Involvement of this canal is vital for determining surgical resection margins. Inferior Orbital Fissure. The connection between superficial facial tissues, the orbit, and the deep skull base. It is the route for a facial infection to spread into the cranium via the Pterygopalatine Fossa. Sphenopalatine Foramen. It is the gate of epistaxis. The sphenopalatine artery, used for embolization or ligation in persistent nosebleeds, passes through here. It is the main transition point for tumors between the nasopharynx and the Pterygopalatine Fossa.